Okay, guys, so basically what Martin's talking about here is doing his head-to-toe assessment. So coming into the room, performing your hand hygiene, introducing yourself to your patient, providing privacy, introduce yourself to the parents at bedside, and explain what you're going to be doing. He's basically just talking about what to look for. In our case, we have a 4-year-old boy who came in for nausea, vomiting, diarrhea, and possible signs of dehydration. So we want to ask the appropriate questions, make sure that everything in the room is there, or suctions, things that we might need in case our patient gets very ill. So he's basically just talking about doing a head to toe assessment from the head to toe. So working his way down, he's talking about looking in the eyes, checking the eyes, doing a neurological assessment, making sure that the eyes react to light with this pen light. You also want to look in the eyes and look for any tear production, or look in the eye orbit for any sunken eyeballs, for any signs of dehydration. You also want to look in the mouth, check the oral mucosa. Is it moist? Is it dry? Look at the lips, see how the lips look. Are they chapped? And find out what the patient is eating. Are they having any oral intake? Are they vomiting? Decrease in appetite? And you want to ask the parents these questions. And he's basically going to go ahead and work his way down to the chest at this point.
I'm going to move down to the chest. You're going to observe symmetry, chest rise and fall, the stomach and the chest. I'm going to auscultate his apical sound, apical pulse for 1 full minute, right? Let's say he's 4 years old, so his pulse is at 96, 105. All right, respirations are, say, 20, 22. Both bilateral radial pulses are present. If he's dehydrated now, you're going to have a weak and thready pulse. So those are common signs of dehydration, because dehydration is hypovolemia, right? You have less volume in your body. So that's that. Low blood volume equals low blood pressure equals low pulse, thready, weak. You're gonna have dry skin, cracked lips, dry mucous membranes, like I've said before. You're gonna have decreased urine output. So at this point, I'm gonna be asking questions as well. I'm gonna direct my questions to the patient, but look to the parent for reassurance. So I might ask the patient a question, and then I'm gonna ask the parent again, because he's only 4 years old. So we're gonna ask about voiding and defecating. How many times was there any loose diarrhea? Another possible sign of dehydration. You lose a lot of fluids there. I'm gonna move down to the stomach. So he's dehydrated. There's nothing in the stomach, right? Or possibly nothing in the stomach. So just going in there, you should expect to hear hypoactive bowel sounds. So you might sit there for 20 minutes. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Alright, now you're going to move down to the legs. You're going to keep observing the skin. You get bilateral pedal pulses once again. They're probably thready and weak. You're going to have a decreased capillary refill just because of the hypovolemia. And yeah, that's pretty much it for a pediatric assessment.
Okay, so the patient is going to be receiving IV fluids because our patient came in for dehydration. So what we're going to do is I'm going to first show you the primary medication, which is right here. And right here it's infused, primary infusion. We have it at 50 ml per hour. And so what we're going to do is I'm going to go ahead and press start. Okay, the next thing I'm going to show you is how to hang the secondary. So I actually need to lower this. So now I'm going to go ahead and lower the primary, which is our big bed, into here. So, and then my secondary is right here. So I'm going to go ahead and attach it. Now before I attach it, we have to make sure to clean with the alcohol swab. So I'm going to go ahead and do that right now. We got to clean the port, which is right here. Okay. Okay, so now that I have that attached, okay, so I went ahead and I pressed secondary, and then before I'm going to press start, I have to make sure that this is unclamped. So just like so. And then I'm going to go ahead and press start. And the volume to be infused will be at 100. Okay, so enter secondary, which is what we did. And then I made sure that this is unclamped, and then I'm going to go ahead and press start.